Well, good morning, everyone. My name is Sarah Verbeest, and I am so excited to be part of this great team that's bringing this webinar to you all this morning. I direct the Jordan Institute for Families at the UNC School of Social Work, and I am the opening act. Next slide, please. So I just wanted to do a little bit of housekeeping. So first of all, we have over 700 people registered. And so because of that, we have all of the phone lines are muted and your participant videos are not enabled. So you can relax and be off camera and listen, but that doesn't mean that we don't want to hear from you. So please use the chat to share your questions and ideas. You can chat as they come to you. You don't have to wait for any particular time. We're going to be watching the chat the whole way through. One thing, if you would note though, there's an option that you send a chat to the panelists or to the panelists and everyone. And we found that the chat and comments are very rich. So if you wouldn't mind to send, if you have something great to say it to everyone so that everyone can benefit from the different observations and perspectives. We are recording this session and it will be posted on our website. So if you're feeling anxious that you can't write everything down fast enough, again, relax. We'll have it available for free and you can go back and watch. And we're going to have a very quick evaluation at the end, and we hope that you'll please complete it so that we can continue to improve what we're able to offer everyone. So again, welcome. We're so glad you're here. Next slide. So since you can't see everyone, we thought it might be helpful for you to get a sense as to who is gathered here today. And so this slide provides information that you all can see based on the agency type, how many years people have been working in the field, and the type of service that your work does. And so we have a lot of different sectors and service types represented here today. Higher education, the nonprofit sector, and state government tend to be among our more common participants. But as you can see, we have everyone all the way down to faith-based and military. And so we're really excited for all of these perspectives. We also have a nice range of how many years people have been working in their field, from those of you that are new in your profession to those that have been around maybe for a minute. So we really welcome that range of expertise and experience. And then finally, we have a lot of public health folks, implementation science people, mental and behavioral health, child welfare, education, health. So nice folks there. So now you kind of have a feel for who's in the room. Next slide. We also asked folks about where they live, their continent, and also how they identify by race and ethnicity. And as you can see from the slide, we definitely have more work to do in our field to make sure that we are really bringing lots of different identities into our space. So it's something that we are watching as a team and think it's really important to build our diversity there. And when it comes to continent, we have a lot of North Americans represented here. And again, welcoming those West Coasters, welcoming our friends from Canada. We're also really excited to have folks joining us from Europe and Asia and Africa. So really exciting to see everyone here today. Next slide. Okay, so now we're gonna warm up your brains. And we're going to do 2 quick poll check-ins. So the first question that we have for you is, what superpower would you like to have? So your choices are invisibility, flight, superhuman strength, or elasticity. So think about this.
We have the results coming in at a rapid pace. We have about 60% response rate. 70%.
What will the answers be?
80%.
That's great. Everyone is showing that they're there.
All right, let me go ahead and just end the poll there, and then I'm going to share the results. Okay, so the clear winner here is flight at 59%, followed by
Yes.
invisibility. I respect it, 22%,
Yep.
and elasticity, 11%, and superhuman strength, 8%.
Excellent. I would say this proves our hypothesis this morning, panelists, that we thought flight would be very something people would like during these kind of quiet, shut-in pandemic times. Okay, y'all are doing great. We have one more quick check-in question, then we'll get started. So this next check-in, we thought it was appropriate given that it's morning. So what's your favorite caffeinated beverage? Coffee, tea, soda, or you are superhuman and just don't consume caffeine?
Results are coming in. We're already at 70%, getting close to 80%.
Excellent.
And I'll go ahead and end the
What
poll
is,
there
yes,
and share the results.
coffee. And 11% of superhumans. Excellent. Well, thank you everyone for taking the time to warm up. And I see people are starting to use the chat. So again, please chat as we go. And I believe with that, I am turning it over. Oh, wait, this is very important. So please tweet. This is our hashtag, hashtag UNC 2021. If there's something that's a really important takeaway or a quote, please share it. Just encourage you to make sure that you attribute any citations to the person who said them. So now I believe I am turning it over to Allison. Yes.
Yes, thanks so much, Sarah. It's so great to have everyone, and we're thrilled with the amount of folks still joining us this morning. So we have a couple objectives just to run through with you all. Our goals for today are to give voice to different groups of individuals who work at the intersection of social justice, equity, and implementation science. We'll be introducing the panel in just a moment. We think we've got some incredible folks to talk with you today. We want to learn together as a field on how to actively decrease the quality gap while maintaining a focus on equity in our work in implementation science. So those are the two objectives for today for us to talk through. And we're really excited about that. So we are doing the welcome right now, and we'll move through this pretty rapidly. And then we're going to move into doing some stage setting. And Anna Bauman will lead us through that, and I'll introduce her in just a moment. We'll move into some panel presentations, and then those panelists will have an opportunity to have a fireside chat together. So we'll get a chance to listen in on their fireside chat after they've had time to do those opening remarks. And then we will open it up. The last 20 minutes or so will be open to Q&A and just looking at comments that are coming into the chat. So please use the chat throughout this entire session because we are monitoring that. And when we get to those final 20 or 25 minutes, we will be bringing up a lot of those questions and also really trying to honor what people put into the chat. And then we'll finally end today with a preview of what's ahead. We've been doing a lot of these virtual institutes, and we're really excited about them. We want to share what will be coming up. So we could move to the next slide. So I want to introduce everyone today, including myself, which I'm not sure I said that as when Sarah handed off to me. So I'm Allison Metz, and I direct the National Implementation Research Network at UNC Chapel Hill. And with Sarah, we have been co-chairing this Institute on Implementation Science for UNC for the last, I guess we're entering into our third year together, Sarah, so it's really wonderful. Another moderator we have with us today who's been part of our planning team is Christine Andrews, who's a director at Child Trends. And I also just want to mention two other folks on our planning committee. You saw Todd Jensen with our school of social work, who's giving you those poll results, and Amanda Farley, who is an implementation associate with NERN, who is behind the scenes controlling these slides and helping us out today. So let me introduce your main speakers for this virtual event. So Anna Bauman is a research assistant faculty at the Brown School of Social Work at WashU in St. Louis. She's also the co-director of the Dissemination and Implementation Research Core and Methods Core at the Institute of Clinical and Translational Sciences. Our next panelist is Dr. Billie Jo Kipp, who is a clinical psychologist and member of the Blackfeet tribe. Billie Jo is the Associate Director of Research and Evaluation for the Center for Native American Youth at the Aspen Institute. Dr. Ruba Para-Cardona is an associate professor at the Steve Hicks School of Social Work at the University of Texas at Austin. Give a little shout out to Austin, which was one of my favorite US cities. He's also serves as the area director of research at the Latino Research Institute at UT Austin. We have Dr. Melody Goodman. She is the Associate Dean for Research and the Associate Professor of Biostatistics in the School of Global Public Health at New York University. And finally, we have Jen Tomasoni, who is an Assistant Professor in the School of Kinesiology and Health Studies at Queen's University in Kingston, Ontario, north of us in Canada. We welcome Anna and Melody and Billy and Ruben and Jen to this panel today. We are so grateful to have them here. Can move to the next slide, Amanda. So one of the things that we just wanted to mention quickly before we dive in is that we will have a special supplement of the Stanford Social Innovation Review coming out in this May, in just a few months. And that special supplement will be on how implementation science can advance equity. So that's not the cover of it there. That's just a cover of a recent issue of SSIR, but we wanted to draw your attention to that because several of our speakers today are part of that session, including Christine Andrews, who's one of our moderators. Both Ruben and Anna and myself actually are part of that special issue. And we're just thrilled that it's coming out. And we plan to do another event related to that. But having just seen all the second drafts come in for all the authors we've engaged for this, I think this issue is going to be really trailblazing for the field of implementation science. So I want to just move to the next slide and just talk through what is it that that issue will cover, because I think many of those areas are going to come up today as we think about the intersection of social justice, equity, and implementation science. So some topics we think are really important in the field as we think about how implementation can advance equity are the role of trusting relationships, knowing that trust and vulnerability are really at the core of effective implementation. The role of implementation in dismantling power structures or putting into place implementation strategies that can address power differentials among groups that are involved in implementation efforts. Investments in decision-making to advance equity. I think we all know that implementation is the result of dozens and dozens of decisions that get made, and each decision that gets made is really a critical point to decide whether or not implementation strategies we choose will lead to equitable implementation. Critical perspectives in implementation. So we know that implementation science is undergirded by many theories and models and frameworks, but really what's missing in the field are critical perspectives. And there is an incredible article that Anna is leading with Denise Long that will be coming out in that issue that will take a look at whether or not there are specific methods being used in implementation science that may perpetuate or exacerbate disparities in outcomes. The role of community-defined evidence and how important that is for implementation, to be working with communities to develop evidence that is relevant to communities, leading to greater sustainability, uptake, and outcomes. And then finally, the role of adaptation and cultural adaptation in implementation, and how important it is that when we think about cultural adaptation, we're not thinking about that only with interventions, but also with the implementation strategies we use. In particular, the service delivery platforms we're looking at to increase access for all. And there'll be some discussion of the role of faith-based organizations in meeting the needs of certain communities. So we're really excited about that special issue, and we just wanted to share that that will be coming out, and we look forward to the discussion today, which I know will touch upon some of these critical topics at this intersection of equity and implementation. So I think we can move to the next slide, Amanda, and I believe I'll be handing it off to Anna to set the stage for us. Thanks so much.
Thank you, Allison, and thank you everybody for being here early in the morning, sharing some really important conversations. I want to say thank you to UNC, including the NERN and the Jordan Institute for Families, for hosting us and providing this space for us to talk about equity. Next. If you are in the Twitter land, do tag us, do engage the conversation. I really, really hope that this is not just a one webinar conversation, that this is an ongoing conversation. Several of us are very active in the space of equity and implementation science. So I'm taking my time so you can get all the tags and join us. Oh, it's okay, next. Okay, so when we talk about implementation science, this is one of the definitions that several of us use, right? So let's set the stage. When I come to implementation science, I aim to study the methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice to improve the quality and effectiveness of health services. Now, if you are in the space of equity, several of us have been writing about, next slide, the potential danger of the silent assumptions of the definitions, constructs, frameworks of the work that we're doing. So we're going to walk through some of the pieces together. Next. If I consider that my work as an implementation scientist or implementation practitioner is to implement an evidence-based intervention in an unusual care setting without really taking a look at the context, oftentimes, this is not new, we see that my intervention is accessing, is helping only one piece of the population, not everyone. If you haven't read, I really, really, really encourage you to read this paper by Julian Hart, where he talks about the inverse care law. This is from 1970. And he talks and he brings quotes from physicians sharing their worries about how people who have more access, higher income, are benefiting even more than those who have less access, less income in the healthcare setting. So it's not that inequality is something new. We've known this for ages. What we need to figure out is what to do with this. Next. So the opposite side of this is equality. Is me providing the tools so everybody can come to my healthcare setting and receive the intervention. I will give you a transportation ticket. I will perhaps give you childcare setting so you can come and receive the intervention that I will develop for you. Next. Which is different than equity. Equity is identifying and meeting people in the communities where they are. Maybe it is me providing an intervention in a different setting. Maybe it is me changing the implementation strategies so you can actually effectively access my evidence-based intervention. Next, which is different than justice. Justice is when I tackle the system, is when we have conversations around racism, around discrimination, around white supremacy, around policies, and how the system is really affecting my intervention. Because I might have the best intervention, but if the context is not allowing the population who actually needs it to access that intervention, I'm not doing quality work or equity work or justice work. So my question to you as you engage in this conversation around equity, around social justice is, how can we, as implementation scientists, and as you develop your interventions and implement your interventions, think about providing a sanctuary for your participants. Next. Okay, equity and implementation science are two big things, and we can spend days talking about them, right? What I like about this figure is that there are many ways and then many lenses we can talk about the intersection of those two fields. Next. As we talk about equity and implementation science, one of the things that I'm learning more and more is that equity is not just recruitment of the participants in your study. It's not just replacing the places where you're implementing your evidence-based intervention. It is an ongoing, ever-going process. Part of that process is you identifying who are you and how the lenses that you have, the body that you have, affects the way that you see things and interact with the world. Let me give you an example. I am a cisgender, female, able-bodied, white skin, Latina. I was born in Brazil, lived in Chile, so I know how to speak 3 languages, often really bad. Pay attention to the word that I'm saying. Recently granted citizenship last semester. Single mom, faculty of a research at a research university. My house is located in the ancestral land of the Osage Nation, Missouri, and Illini Confederacy. I cannot say this. And as such, I have a privilege to sit in a land where people had been displaced. And I want to honor the Native peoples who own this land. If you've heard me talking recently, you've heard me labeling the constructs that make me who I am. And the more I talk, the more I add them. Why? Because all those constructs are affecting the way that I see myself, that I interact with my population, that I interact with my research question, and that I use the power that I have in some settings and the fight for the power that I should have in other settings for myself and for the populations who I work with. And so as you engage in the conversation today, I would like you to reflect, who are you? And what are the constructs that make you powerful? And how you use that power to engage in allyship and support equity work. Next. I also like this picture because we are a village. And we're going to hear today leaders in the field talking about pain, trauma of different communities. As such, the world is big and we are part of a big community. Next. I really do hope that we get uncomfortable, because if we don't, we're not having equity work. But as we do get uncomfortable and as we share some of the things, I do ask you to be respectful. Engage in the chat, engage in the Twitter land. If your emotions are higher, check on them, take a deep breath. And I do hope that this, again, conversation is not just of today. It is part of ongoing reflection that we as a field need to have. Next. So for the next section, we asked our speakers to talk about the populations that they work, they collaborate with, and offer their perspectives on where the implementation field have fell short and why are we not reaching equity for the populations that they're talking about. Next. So with that, as Alison mentioned, we have an amazing set of speakers. I'm extremely excited. I'm very honored to be here. Next. And I will pass the mic to Dr. Billy Jo Kim.
Good morning. I can't see myself on there, so that's good. So thank you for having me today and including me in this critical discourse. I'm enrolled Blackfeet, but I come to you from the land of Duwamish, Tulalip, Muckleshoot, and Snoqualmie, who still inhabit this area around Seattle. And so I am the Associate Director for Research and Evaluation at the Center for Native American Youth. And I have about 20 years of child psychology with tribal nations. And so that really has framed my work and has really propelled what I'm going to present and talk to you about today. So next slide, please. So the Center for Native American Youth really believes in that our youth are really the key to who we are. And that really has underpinnings in our Indigenous framework, our philosophy, and our teachings. We believe that whatever we do for 7 generations to come. And that through our youth come the new ways to do things, there are power. And that connection between our youth and our elders is critical in moving the nations forward. And so we are a policy program funded under Senator Brian Dorgan, who's retired. And what he did is he took his money that he was going to run on and instituted it in Aspen and developed the Center for Native American Youth. We do this through recognizing our youth, through listening to our youth. We do it through leadership and inspiration, research and advocacy, policy change, and having a national resource exchange led by and constituted by the Native American youth, and it's driven by them. Next slide, please. Oh, back to that slide really quick. I just want to say that the picture there is of a young boy who identifies as female in a tribal village. You can see his moccasins are pink, and this was done by one of our youth. We had a contest. It's a beautiful rendition of the acceptance of all things in Indian country. Next slide, please. So these are some of our youth. We empower our youth to find ways to capitalize and to develop projects within community and to listen to their peers. And we listen to their peers and their family, and thereby they institute and develop critical projects that are going to make changes in their communities and Indian countries. Some of our youth have developed mental health trajectories. One of our youth was featured in Teen Vogue. Another of our youth developed a play on missing and murdered Indigenous women and girls. And she has been lauded across the nation for her play. And we have another youth who during the pandemic or during the COVID, which we're currently in, developed a way to engage with elders and make sure elders on the Navajo Nation received quality food. So it's really this intergenerational movement of taking care of our communities and helping to strengthen our youth through what they know. It's driven by them. Their projects are driven by them. We provide tools from an Indigenous framework to help move their projects forward and help to validate that their movement and their goals and objectives of their project really do fit. And so it's fitting what they do, and we match that with our Indigenous framework. And it's really a wonderful synergistic event and relationship with our youth who go out and do very, very critical work in tribal communities and tribal nations and across the nation. I think it's really key that many of our youth interact. We offer an opportunity to interact with Congress and many of our congressional people, because we know that that's going to propel funding and that's going to propel some changes. So we give them tools to do that and give them opportunities to network in that area. Next slide, please. So I think it's really important that we're talking today about equity and equitability, because the issue is that tribal communities have a history of trauma, a history of distrust of agencies that are currently on reservations and in tribal communities. Let me go further to that. I'm currently engaged in research with Johns Hopkins University about looking at the response to accepting and engaging in getting the vaccine. And while we know that tribal communities are disproportionately affected by COVID, we also know that the distrust of our healthcare systems, including IHS and even our own tribal health system, is influencing the decision on whether or not to take and get the vaccine. This is a critical moment in time, I think, for tribes, especially around this, and a critical opportunity to understand that what mainstream society sees as best for tribal community comes with a lot of history and a lot of loss and trauma. So the systems that have been set up in tribal communities were built out of the government response to genocide and trying to rid the universe of brown people, of native people. And so thus those systems of care and those systems that we were given based on removal of lands now have become an oppressive colonized um, arm of the government and highly distrusted. So it's really important that when we look at tribal communities, we don't have the answers. We have to engage with tribal communities and collaborate them. I think one of the best things that I've had happen in my career is I got to work for several years as associate scientist with the community-based participatory research at the University of New Mexico with Nina Wallerstein and Bonnie Duran. And that really helped me to move forward and understand that we don't design the interventions. The interventions have been designed, but irregardless, mental health and substance abuse and education still falters in tribal communities. So it's re-imaging tribal communities. It's disrupting those epistemologies that continue to impact us and helping tribal communities and supporting tribal communities into developing culturally supported intervention. It's not, oh, we're going to look at the culture and see what fits in our intervention. No, it's the culture is the resource. The culture is the intervention. And how can we help partner with the culture to have a more deeper approach, a relationship-based approach to health disparities in Indian country. So these historical factors continue to impact how we interact with oppressive systems, even those oppressive systems that have historically been in our communities. Next slide, please. So in understanding tribal communities, it really requires an understanding, like we do in the USA, of the political system. Tribal reservations are sovereign nations, and they have the oversight and administrative oversight. Our tribal officials make the decisions as they are elected or appointed, or even brought into the community political system through traditional ways of being and knowing and knowledge. And so in order to understand how to influence tribal communities and help with health disparities, we got to clarify, and I think it's really critical that the historical trauma and the loss in tribal communities that continue to affect how we make decisions. So part of what we're doing now with the research I'm doing with Johns Hopkins is looking at how are decisions made in tribal communities and what are all those factors that come into your decision making before you decide to get the vaccine. That seems like a relatively black and white question, but it's not, because of the level of trauma that we feel. So we have trauma from daily loss. We've lost 39 people on my reservation. It's very isolated, very marginalized, right on the border of Canada and Montana, but yet there's still a resistance and fear of the vaccine, because the history and the trauma of American Indians is that we've been treated and researched and had forced sterilization and all those inequities and very stark realities that really influence our trust in moving forward with any kind of intervention or any kind of medical science. So it really continues to impact us. So when you work in tribal communities, when you try to equalize the playing field, if that's even possible, I think it's really important to understand that it's not a cultural adaptation. It's a cultural supported, and it's more relationship based. Indian communities are very relationship based. And so what we do at the Center for Native American Youth and the Aspen Institutes, we empower our youth and we support our youth in their trajectories and their hopes for their communities. And that's what we do. I don't think I have any more slides. No. No, and I think I'm below the 7 minutes. I hope so. But in summation, I'm really excited, and I'm really honored to be a part of this panel, because as you can see, it's a panel with very multicultural. We are a multicultural world, despite what other people say. And I really think it's really critical that we have this discussion, because to have this discussion and to have a Native voice in it, when I hear Joe Biden say, "and the Indian nations," and when I hear it blows me away, because we've never been included. And now there's a level of inclusion. It's a start. It's a start, but there's much more to be done. And I am excited for the discussion afterwards, and I'm excited for any questions or even any responses in adverse to what I have said. And at this point, I am going to pass it over to Dr. Para Cardona. I can't roll my R's, Dr. Cardona, so I'm sorry. And he's going to take on the next section.
You did great with the R's, Billy. You did great. Beautiful presentation. Thank you so much. And welcome, everyone. It's a pleasure being here today. I want to thank all the organizers, and I want to thank all the participants who are here today. This is very, very exciting and hopeful conversation. I come to the implementation science field after almost 20 years of conducting cultural adaptations for low-income Latino immigrant populations in the United States, and we have carried this work also in Latin America. So that's been my world. How is it that we take evidence-based interventions, parenting interventions that we know work and work very well, and disseminate those, adapt them, culture adapt them, and disseminate those in underserved Latinx populations, Latino populations in Latin America. Next, please. So when we pose this critical question, where do we see the implementation field falling short at the intersection with equity? Coming from the cultural adaptation world, several reactions came to me. The first one, I think it's feeling overwhelmed with the hundreds of frameworks and theories and models and trying to figure out as a new person in the implementation science field. But my trouble was related to the assumptions that were not being addressed, to the agendas that were not being being permeated, but also to the components of our history that were not being addressed. So for example, the United States is the world's strongest economic power. Next, please. But when we look at that graph, we never associate that with, hey, we are there because there's a history. And one of those histories is the foundation of slavery as a nation that we continue to grapple with. It hasn't ended. There's been abolition, but the foundation of slavery we continue to grapple with. And racial discrimination and the ways in which it has been permeated across years. What you see on the right is not Nazi Germany. It's a picture of the United States Department of State health officials actively recruiting Latino immigrants during the crisis of World War II, when the United States was collapsing. So there's a history in the United States when the United States is in crisis, goes to the force, and an unacknowledged force, of these vulnerable Latino populations. And throughout history, we can see that many times Latino immigrants have served as a scapegoat. So few people know about how this history goes back and the critical role that Latinos have had throughout the history of this country. Next, please. Next, and next, and next, and next. So when we run parenting groups, parents tell me, Ruben, we give ourselves to this country. We want to make sure you have food, you have beautiful houses, that you have standards of living. And of course, when we go to our convenient grocery stores and we don't have fresh fruits and vegetables, we complain. We don't think about immigrants still being sprayed with pesticides in those fields during COVID times. Many of when you look at the disproportionate rates of COVID infections, because many of these low-income Latinos just could not stop working in lines of work that are essential to the US economy. So Latinos give their lives to these because they want a better future for their families, right? And they pay taxes, they accept all sorts of exploitative practices from their employers. But what they see is this. Next, please. And next. They see this, and one of the most difficult questions I have to answer or grapple with or just sit with when we run parenting groups is, we do so much for this country. Why are we so hated, Ruben? Next, please. And part of that is that the implementation science field, I consider, remained pretty much silent during one of the most intense humanitarian crises of this country. Next, please. Where pervasive human rights violations that we had not seen before took place. Next. This is one mother talking about the impact of the really pervasive Trump administration policies and the effect that it had in his son. My son was bullied by classmates at school because I'm an immigrant. It got to the point of him saying that he wanted to die. We suffer by being immigrants, but our children suffer even more. Next, please. So this is very dramatic. An adolescent contemplating suicidal ideation because he's been bullied by his classmates yelling at him, oh, your mom is a wetback, your mom is a wetback. And that's the reality we see as we are implementing interventions. These are slides show one of our first cultural adaptation studies in which we sought to address the question, does overtly addressing discrimination have an impact? And the first slide that you see is that when we compare a good adapted intervention of an evidence-based parenting intervention, PMTO in this case, compared to an enhanced intervention in which we overtly address discrimination, and compared to a control group that you see is the line in here, we see that the two adapted interventions overall improve parenting practices for both groups. But the question, is it relevant to overtly address discrimination? It is really relevant because when you look at the most the strongest effects on child mental health, those children in families in which we overtly address discrimination in the parenting group in terms of how does discrimination impact your children, how does discrimination impact you and your parenting practices, we see that the strongest positive impacts on child mental health problems was associated with that intervention. Next, please. So another place where we're falling short is that the voice of academics and researchers are overemphasized, in our view, in the implementation science field, where the voice of communities, organizations, leaders in those communities who are fighting the fight every day with underserved communities are minimized or not included at all. And this is, I love this picture because our work has been grounded in faith-based organizations. In the Trump administration, we tried to do our work in schools, community centers. We were hit by ICE. And the only place where we were safe for our families were churches. That's where we were not touched. And we rarely acknowledge that in implementation science frameworks in terms of what are the drivers of safety by communities as determined by communities. Next. So we have tremendous challenges. We have witnessed 4 years of tremendous human rights violations, but that have started all the way from the foundation of this country, in which unacknowledged privilege, unacknowledged dynamics of oppression need to be addressed into the current implementation science frameworks and models that we have. So how is it that these golden interventions that we know that can impact families, how is it that we can duplicate those by always looking at that picture in the left in terms of power, privilege, and oppression? Next. And that's what I want to thank all the organizers today, because there's hope. There's hope by having this conversation that I know, as Anna mentioned, is not going to be the only one. It's just the beginning of many. And there's hope by all of you here today. And for that, I want to thank you, because there's so much to be done. But the fact that we're having this conversation gives me so much hope. And with that, I'm going to turn it to Dr. Melody Goodman, which has prepared a wonderful presentation in focus on Black populations in America.
Thank you, Dr. Parra Condona. Thank you all for having me today. I'm going to talk about the work that I do, particularly a lot of community engaged research with Black populations in the urban and suburban US settings. Next slide, please. So I am talking about Black and I'm talking about race, but I want to be clear that when I talk about race, I'm talking about race as a man-made social construct, and that racial categories reflect social and ideologic conventions, not meaningful natural distinctions. Next slide. So I like to use Dr. Kamara Jones' definition of racism because I think it fits into the public health framework really well. And she defines racism as a system of structuring opportunity and assigning value based on the social interpretation of how one looks, which is what we call race, that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And this idea that we don't have genius in our ghettos, in our barrios, and on our reservations is really important for us to think about the fact that we're losing human capital that can really benefit us all as a society because we only see certain individuals as beneficial, smart, intelligent, etc. Next slide. So we've been talking about the impact of Black Americans for a long time, particularly Du Bois in 1899, when he said the most difficult social problem in the matter of Negro health is the peculiar attitude of the nation toward the well-being of the race. There have been few other cases in the history of civilized people where human suffering has been viewed with such peculiar indifference. Right. And so the fact that we just don't care, it's not that we don't know that these equity issues exist. It's not that we don't know how to solve these issues. It's often that we don't have the political will to make change. And to be clear, there was a recent commentary in the New England Journal of Medicine talking about racist policies as the root cause of US racial health inequities. And in that they state, change will require policies that restructure the chances for a healthy life for people of color, righting the wrongs done by foundational racial hierarchy that continue to shape everyday life. Next slide, please. So me and my colleague have been talking about the fact that we have been discussing at least Black-white disparities and lots of other racial ethnic groups for a really, really long time. And we've developed reports, we've opened centers of minority health, we've had major state and federal and programmatic efforts. But the fact that we knew this from 1899 and we're now in 2020 and things are still 2021, sorry, and things really have not changed, really shows what we have done. Next slide, please. What we have created is a new industry in America that is designed to eliminate health disparities. And because it is an industry as described by Shaw Ridley and Ridley, it really talks about the fact that there is some benefit for people to not make real changes, right? And so many of the current interventions that address health disparities are often colorblind. That is, they provide individuals with immediate care, but they're not intended to address the broader racial factors that may undergird disparities. Next slide, please. So a lot of my work really focuses on place and race and residential segregation. And a great resource for me was American Apartheid, written by Macy and Denton. And in there, they say, where you live has a big impact on your education you receive, the safety of your streets, and the social networks you can leverage. And it's clear that housing is really key, and that housing is a way that we've been structurally limited in terms of opportunity. Next slide, please. So place really matters. Geographic location determines your environment. That's your social environment, your physical environment, your built environment. And residential segregation is one of the major causes of health disparities. It's the structural linchpin that maintains structural inequality in the United States. Prior research has found associations between segregation and poor health status, poor birth outcomes, infectious disease, exposure to toxins, mortality, and health literacy. And what we know from public health is that your zip code is a better predictor of your health outcomes than your genetic code. And it's really important, particularly in this time of COVID, when people act so shocked. We are not surprised that things are playing out the way they're playing out. Next slide, please. Residential segregation is key into how we've sort of structured opportunity in this country. It contributes to differences in social and physical environment that affect social economic status, housing, education, quality jobs, safety, social networks, access to and quality of goods and services, and access to and quality of medical care. And we know in the United States, communities of color have higher poverty rates, lower median incomes, poorer schools, older housing stock, and lower home ownership rate. So when I'm talking about segregation, I'm not talking about the fact that different people want to live with people who are like them. In some ways, we've seen that racial enclaves have been protective. But when I'm talking about segregation, I'm really talking about the fact that segregation is more than just the physical isolation of people. It's isolation from opportunity and opportunity structures. Next slide, please. So when we talk about racial differences and we think about it in the US, in the 171 largest cities in the US, there is not even one city where whites live in ecological equality to Blacks in terms of poverty rates and single parent households. The worst urban context in which white residents reside is considerably better than the average context of Black communities. Next slide. And that segregation in America was imposed by legislation. It was supported by major economic institutions, including our banking structures. It's been enshrined in housing policies of the federal government. It's been enforced by the judicial system and vigilant neighborhood organizations. And it's been legitimized by the ideology of white supremacy that was advocated by the church and other cultural institutions. Next slide. And there's lots of documentation about the fact that when affirmative action was white, people weren't fighting against it. But once affirmative action really started to help minorities move ahead, that people started to fight it. And the fact that redlining and where you live and how racism takes place, we've documented all of this before. Next slide. And segregation is distinctive for Blacks. Blacks are more segregated than any other racial group, probably besides Native Americans, right? And so who were sort of forced into sort of ethnic enclaves, right? Segregation varies by income for Latinos and Asians, but is high at all levels of income for Black. The wealthiest Blacks, I'm talking about those that make more than 50K, are more segregated than some of the poorest Latinos and Asians. And middle-class Blacks live in poorer areas than whites that have similar social economic status. Poor whites live in better areas than poor Blacks. And Blacks show a higher preference for residing in integrated neighborhoods than any other racial group. Next slide. So I'm a biostatistician, and we talk a lot about data, but I want to be clear that data never speak for themselves, and we have to develop the appropriate narrative for our data. So Lawrence Bobo said, data never speak for themselves. It is the questions that we pose and those that we fail to ask, as well as our theories, concepts, and ideas that bring a narrative and meaning to marginalized distributions, correlations, regression coefficients, and statistics of all kinds. Next slide, please. I want to pass it over to Jen Tomasoni.
Thank you, Melody. Thank you to the organizers for inviting me and for the other speakers for their great presentations. But before I begin, I would like to acknowledge that Queen's University is situated on the traditional territory of the Haudenosaunee and Anishinaabe peoples. This land has been and is still the home to many Indigenous nations from across Turtle Island. I am grateful to be a guest and have the opportunity to live and present in their territory, and I'm committed to reconciliation and supporting the human rights of Indigenous persons in Canada and everywhere. Next slide, please. As a faculty member at Queen's University, my research group aims to promote quantity and quality of physical activity participation to persons with disabilities. My research is primarily based out of Rev'd Up, which is a community-based exercise program for persons with disability in Kingston, which I co-direct. And so as both a researcher and a practitioner who promotes physical activity to persons with disability, I want to take a moment to acknowledge that I do not identify as a person with a disability, but I aim to promote equity in my work by engaging persons with disabilities at all stages of my research. So from identifying the research question through to dissemination and implementation of findings. When promoting physical activity then, I remember to acknowledge my position as a person without a disability, which underscores the importance of working with persons with disabilities to understand and work within their context. So as you can see on this slide, the main model I use to guide my research and practice is Graham and colleagues' knowledge to action framework, which suggests that understanding the context is a critical step to ensure successful knowledge translation. But it wasn't until a recent experience I had where I came to recognize that understanding or simply acknowledging the context and then working within it is not enough. As implementation scientists and practitioners, we do have a duty to use our privilege to address the systemic issues within the context. Next slide, please. So I'm going to tell you a little story. Canada boasts its leadership for being the first in the world to establish 24-hour movement guidelines. These guidelines provide public health recommendations for how much physical activity, sedentary behavior, and sleep individuals should accrue for health benefits. These guidelines are owned by the Canadian Society for Exercise Physiology. They are funded by the Public Health Agency of Canada, and they're supported by Participaction, which is the organization responsible for physical activity messaging in Canada. The guideline target audience is persons without disabilities. And so the studies reviewed when developing the guidelines excludes evidence for individuals with a disability. The rationale being different physiological responses and contraindications to physical activity for these groups. Next slide, please. The 24-hour movement guidelines for children and youth were developed first in 2016 and came out with a brand, a 4 to represent the 4 speeds of childhood: sweat, step, sleep, sit. Following guideline release, Handler and colleagues explored parents' perceptions of the guidelines and brand. Mothers of children with a disability said that the guidelines and brand were not inclusive nor compatible with the needs of their children, but that they would not expect the guidelines to meet their children's needs because they never see disability represented in public health messaging. Despite this finding, the same branding was used for the 24-hour movement guidelines for early years in 2017. My work with this enterprise began in 2018 as the adult guideline development process started. I was appointed as the knowledge translation lead, and along with a team of other researchers and representatives of the main funders and drivers of guideline dissemination, we are responsible for planning, executing, and evaluating all guideline knowledge translation efforts. I want to note here that this KT team is comprised of individuals who do not identify as having a disability. Given the guidelines are not intended to target persons with disabilities, we did not actually consider including a person with a disability in our knowledge translation group. So as we were planning the messages that would accompany the guidelines, there seemed to be consensus among those involved that the sweat, step, sleep, sit tagline should remain, and that the tagline, move more, sit less, sleep well, would capture Canadian adults' attention. My colleague, Dr. Amy Latimer-Chung, then brought to our attention a paper written by Smith and Whiteman, which highlights that demonizing sitting and telling people to sit less communicates ableist ideals, albeit often unintentionally. The message "sit less" suggests that bodies who can stand or avoid sitting, in other words, the bodies of persons without disabilities, are favored over others. Our group was invited to pause and consider the implications of proceeding with the messages. This discussion was met with resistance and a ton of discomfort. Some of those involved in our group highlighted that the message "sit less" was already used nationwide and worldwide among high-profile researchers and organizations, and so we should use it too. Indeed, I'm not proud of this, but the "sit less" message is used in a physical activity policy document in Canada. Other arguments were that considerable time and money went into the previous branding of the guidelines, and that repeated messaging would be better for guideline uptake. Following substantial discomfort, discussion, and reflection, the weight of the arguments in support of keeping the "sit less" message did not compare to the potential unintended harm that this national message would have on the 22% of Canadian adults who have a disability. Next slide, please. We agreed to remove the sweat, step, sleep, sit notion from the brand, and we changed our color scheme to highlight the new approach. We also chose to go with a less catchy but far more inclusive tagline to promote the guidelines. This new message does not lend itself to unintentional feelings of isolation or inferiority among Canadians with a disability. Now, this decision came fairly late in the game, and we had to backtrack and work hard to adjust our messages to meet the deadlines. And this issue may have been avoided altogether if we had engaged a more diverse and inclusive team. But as a group of researchers and practitioners without a disability, we recognized our privilege and used our position to advocate for more inclusive language in our messaging. This change may seem subtle to outsiders or the general Canadian population, but it marked a substantial turning point in how those involved with the 24-hour movement guidelines think about equity. Our decision has already begun to foster some positive change in public health messaging in our country. For example, the Canadian Society for Exercise Physiology has since agreed to feature population-specific guidelines on their website. Despite not developing or owning these physical activity guidelines, they are committed to supporting access to these materials for persons with disabilities. In addition, Participaction, which is the main organization responsible for physical activity messaging across Canada, has since developed a disability advisory team that is reconsidering the inclusivity of all of their previous messaging campaigns and is committed to promoting equity in their messages and campaigns moving forward. Now, not only can Canada boast leadership in the development of these 24-hour movement guidelines, but we can be proud of challenging the pervasive "sit less" message, acting in allyship to those who are not targeted by our guidelines, and starting a ripple effect when it comes to promoting equity in public health messaging in our country. Thanks for listening. I would like to pass it over to Anna to facilitate our fireside chat.
Wow. I don't know how you are feeling. I am feeling overwhelmed, honored, uncomfortable. All the feelings are feelings right now. So I have lots of notes, and I see that the chat, I think you guys are engaging, they're sharing of materials, so keep doing that. As we start the fireside chat, and as we heard your comments about all the work that we have a lot to do, we're gonna go through the panelists, and I was wondering if you could think, what is equity, or what will be justice, liberation, from your perspective, for your community or the communities that you talked about? And how can the field of implementation science achieve that? So hopefully not too long, what will be equity look like? What will be justice look like? Maybe we can start the other way around. So Jen, if you can start, and then we can go backwards.
Sure. So I think what I wanted, one of the take-home points of my presentation to be was that we should not only consider the impact of our implementation efforts on our target population, but also the potential unanticipated efforts on those who are not included in our target population. And so even if we aren't working with or among equity-seeking groups, not forgetting that these groups exist and can be impacted by our work. And so I try to engage in integrated knowledge translation whenever possible, which is all about engaging those who will benefit and use the efforts from the get-go. But and we know that there's obvious benefits for the people involved. So, you know, giving people voice and shaping the implementation science efforts and building their capacity for doing implementation. But it would be great if we can start to think about including a more diverse group in the efforts, even if it doesn't seem like their voice needs to be considered. And so in 5 or 10 years, I think I would love to see more efforts on implementation for and with all of the equity-seeking groups, and more automatic recognition and consideration by researchers and practitioners about how their efforts may have trickle-over effects, and ensuring that there is no negative effect overall of the hard work that we're doing. I'll leave it there.
Thank you.
For me, if every child has the ability to grow up in a healthy community, regardless of what they look like, what their parents' station in life was, that's what equity and justice looks like for me. And I think for the field of implementation science, for us to think about not just evaluating interventions for how they work in a population, but also evaluating whether they reduce inequalities.
I think I'm next. And for tribal communities in particular and tribal youth, I believe equity looks more relationship based. And it's more about listening and hearing and understanding and not coming in with a toolbox full of interventions that, oh, this works. And why don't you add some beads and some song to this and it will work in your community. I think it's really developing that from the communities and having a deep understanding and relationship with those communities on what historically has worked, what historically has traumatized us, and how do those things continue to impact our behaviors today. And so it's really a deeper relationship and understanding and collaboration with tribal communities.
And I think for me, let me go to an example of parenting and the parenting work we do. We have an undocumented Latino immigrant who works 14 hours per day. At the end of the day, after working 14 hours, gets paid 7, and the employer says, do you want to complain? Let me call eyes on you. And that Latino parent goes home and doesn't have the best tools to parent because comes from a very impoverished background and is really committed to his children, but just doesn't have the knowledge that he wish could have. So I think for me, the dream of equity would be, you don't have to worry if you don't have health insurance. You don't have to worry if you don't have money to pay a private counselor. They have this resource in this community for you. And you can come here to a place that you know is safe. You are not forcing you to go to a mental health center that doesn't get it, or where a community center where ICE has made raids. We have this in this safe haven for you. But also we have an intervention that responds to your cultural values and the contextual challenges to that discrimination that you experience on a daily basis and how that impacts your parenting. But also the person who delivers that intervention looks like you, feels like you, and knows your struggle, is not somebody detached from this community. So we have embedded these interventions in these communities by people from the community, community-based interventionists. And that would be an example of that. And going back to Dr. Goodman's feedback is not only that, how do we can use that aggregated knowledge to promote second order changes in the field to straighten up the tree that you have in your beautiful slide. So it's intervention, but also second order change to change the status quo.
Thank you. With this wisdom, I wanna give space for the chat. I know that the chat has been very active. Allison, Christine, help us.
Hi, everyone. This is Christine. I have been following some really engaging discussion in the chat, and I'm thankful that we have some time to bring those voices into the room. I have some questions that have been posed. I've been hearing some really thoughtful comments that I want to share for the whole group to hear in case you missed it in the chat box. And then I have some specific questions around that tree diagram that Anna shared in the beginning. So I want to make sure we get to as many of those as we can. I want to start with a few important comments that were raised because I just want everyone to hear some things that were raised that maybe you didn't have a chance to read. So first, I wanted to just bring into the room, and I apologize, I don't have all the names copied out here, but I just want to lift up the voices. Someone reported that I'm glad to hear that I'm not the only one who gets overwhelmed by different models and definitions and figuring out how to use implementation science as a system and incorporate or coordinate at the system level versus implementation of individual interventions, because it's very rarely any large system implementing only one thing. I thought that was a really important comment to lift up because I just want to normalize that. I think many people can probably relate, and wanted to echo, yes, you're not the only one. A specific shout out to Ruben for referencing the importance of having undocumented immigrants being able to safely access interventions in faith-based institutions. We often don't fully think about how welcoming and safe institutions are. And then for Dr. Goodman, one of the comments around this residential segregations, you were talking about how zip codes are key to outcomes experienced. There were some important links being shared in the chat around the America's Caste System, a reference to Palaces for the People and the Color of Law. So I wanted to make sure folks go in the chat and see those references being cited. And also naming it for what it is, right? I heard some chat around naming it as white supremacy, naming it as apathy, and stop looking the other way. And the last comment from Dr. Goodman's was around, it's always possible to wake someone from sleep, but no amount of noise will wake someone who is pretending to be sleeping. If we're able to name and acknowledge that white supremacy is central, we can start beginning the waking up. So it's just some deep comments, folks, I wanted to share. And they also left your last reminder around the narratives and data analysis. I have some quick points around Jen's talk, great points in how we can unwittingly send disempowering messages. They loved your examples about how to be more inclusive and appreciated your willingness to talk about the process and the time it takes to move the group through discomfort to make changes. And just appreciated your transparency and storytelling. Okay, so to the questions. Okay, I know that's what you really want to hear. So one question, and I think this is specific for Jen, for Dr. Tomasoni, appreciate the consideration of inclusivity, but I still wonder if the messaging around personal responsibility for health via activity guidelines is inherently problematic for equity efforts, as often the disparity is related to systemic issues versus lack of personal knowledge or willingness to act. So I'll give you a moment, Jen, to respond to that.
Great, thank you so much for the question. I did see that come in on the chat, and I've been racking my brain about how to answer that. That's a great point, and is something that we have recognized as a limitation to the way that public health guidelines around physical activity, how they're produced and how they are messaged. One of the things that we were sure to do this time when we before we released the guidelines was that we did ask Canadians for their input around the inclusivity of the guidelines. We did tons of formative research about the types of messages that are coming out, and the main messages like make your whole day matter. What we were trying to do with them is empower individuals where they're at, that your whole day is limited in the amount of time that you have. And so we're not telling you to go to the gym and buy a gym membership and do these expensive things. It's sort of trying to give options within people's space. And so with that, we also received lots of great ideas from a wide audience, stakeholders, general public, around how we can improve our dissemination and implementation efforts moving forward, and what specific types of interventions, or I should say strategies, are required in order to reach some of the more equity-seeking groups. And so our knowledge translation team is currently unpacking all of those. So the messages that you see right now are just a starting point. And as we've had media attention with the guidelines, and as we move forward, it is something where we're sensitive to equity. Equity is now like in the forefront of our mind with every single initiative that we have. So I totally hear you. I recognize that the personal responsibility for health sort of goes against the idea of equity, but as a KT team, we're trying to shift that. And so my hope is the next time the guidelines come out, or any sort of public health messaging comes out, that it won't be an afterthought.
Thank you for that response. I think I have some more time, so I'm going to keep going with another question. This is, I think, really for any of the panelists to chime in, and it's speaking specifically around implementation science, and wanting to know, how are we really able to hold organizations accountable when their priorities are focusing on DEI now? And is it just artificially connecting it to their models and their narratives and their work? How do we think about integrating historical and temporal dimensions, structural racism, as you think about implementation science in organizations? So it's a big question. I know any of the panelists, if you have thoughts around the organizations that are adjusting their priorities to focus on DEI.
Let me try and take a stab at that. One of the things that I think quickly has to happen is the representation of people that look like this panel in levels of academia, in levels of board membership, in levels of those decision-making areas. And that's not occurring. Regardless of what we say, that's not occurring. Academia is based on white principles to keep women and people of color out. I think it's so interesting that the recent report came out that of all those losing jobs, women were losing the most jobs, like at 100%. So that's critical. And I really think that unless we change the systems from the top down in those decision-making places, I mean, for me, just to have Native American and tribal sovereignty roll out of the lips of our current leadership was phenomenal. I haven't heard that in 4 years out of the leadership. And so I think really validating who we are and our contributions may not look like what white sterile academia thinks. Our contributions are quite different. And we have to honor those contributions, but we also have to be in places of decision making.
Yes, I just want to second that, Billy. I think leadership and being at the table is essential with our voices. When I started to be a consultant for the federal government and I heard a conversation by Euro-American researchers talking about programs implemented with Latino and Black populations, I was just taken aback. It's like, wow, this is where decisions are being made about our people, and we're not here at the table. And that has increasingly changed, but there's so much that remains to be done. And I think as researchers, the questions we pose are critical because when we submitted our first proposal, one of the reviewers, when we said we need to do cultural adaptation, one of the reviewers said, how do you know culture is relevant? And that really pissed me off. But that really propelled us to design a research design in which with empirical data, we demonstrated the impacts of overtly addressing discrimination compared to not overtly addressing it. So I think we just need to embrace the fight. We need to create a community like the one we are creating today. And we need to aim high to be at those levels of decision making that can promote the second order changes, not only how to do interventions, but how to infuse ourselves in the capacity to modify the systems where power and control reside.
Thank you.
Can I
Oh,
touch
sure.
a soft spot? So we're all like, yes.
Okay, go.
I just want to highlight, yes, to exactly what Billy and Ruben mentioned. I also want to point out that going back to the framework situation, there's tons, and apparently we're all creating more to talk about equity. We're just adding to the mess. In the process, I think there's also a high need as we train implementation scientists and practitioners to talk about equity, social justice, historical aspects in our training. So we are, as a field, trying to figure out what is an implementation scientist, what are the competencies? And if you think about the competencies, it's pretty disentangled from historical context, from community, from engagement. And so I would advocate that we need to sit down, we need to be uncomfortable, and we need to think, as we do that, what are the strategies, implementation strategies that we are using to all of your guys' aspects, to engage the communities, to address social determinants of health, to examine how we're really doing social justice if we are to, as implementation science say, decrease the quality gap. So that's my.
Yes, thank you for bringing in equity and implementation science training. Allison, you wanted to chime in?
To lift up a comment that is similar to what we're talking about. I thought was so compelling in the chat from Perla Chebley, that great insights from all panelists. I keep wondering if impactful systemic change to achieve equity can occur in scientific fields like implementation science without involvement in activism, advocacy, policies, to uproot the systems that perpetuate the inequities we keep documenting. And what do you think our roles as academic researchers, practitioners could look like in that context? I think that gets at a lot of these comments. And I was thinking about this idea that often what implementation science has been doing has been documenting or describing context rather than addressing it and changing it or taking any sort of responsibility for those kind of macro level implementation strategies. I just felt like that comment. So thank you, Perla, for that comment. I just wanted to honor that. I felt like it resonated with what the panelists were saying. I think we still have time, Christine, for one more question. I'd just like to finish up with just 2 minutes left to do some housekeeping, but let's go for one more.
Oh boy, I have to pick one. Okay. Oh man. You know what? I think I am going to raise up the conversation around this apple tree, Anna, that got so much conversation. People do want the source and the link to that if possible. But there was a big conversation around liberation. And you referenced equality, equity, justice, and wanting to get a definition or a description of what would liberation look like in that apple tree diagram. So there was a lot of back and forth chatter about that, and wondered if you had any thoughts to share around what that would look like.
You know, I really want to confess that this is really recent thought about equity and social justice and liberation that I am struggling as well. Hence, for all the comments that the panelists are sharing, right? It's not about the intervention. It's not about recruitment of participants. It's not about adding a cultural adaptation. It's about all of that and affecting the system, right? If the system is meant to put us against each other, and if it's meant to destroy us really as communities, we have to address the system, and we have to really liberate ourselves by dismantling and engaging in the conversations that we're engaging right now. This is me learning. So I'm putting myself right now extremely vulnerable because I think that's part of the equity work. But I also, would like to refer to to the panelists who have been doing a lot of work in the community in terms of what is liberation, because I think liberation could be very different depending on the communities that you're working with. So if you can summarize in one, if you could summarize in one sentence, liberation for your community.
I'll try, and then Ruben, I see you're wanting to try. It's been said by an elder that there's a difference in telling us what to do instead of asking us what would help. And in tribal communities, we've had history of telling us what to do. And I want to go back to Dr. Goodman's example about residential housing and housing inequities. When we go to reservations, people say, well, look at these houses that the government provided for you. And you got cars in front of them and the lawns aren't nice and that. But nobody, when they gave us HUD housing, asked us, where do you want your door? Where do you want your window? Spiritually, our door has to be to the east because that's who we are as Indian people. That's where we get our power. Other tribes are different. Nobody asked us that. Nobody asked us, what color countertop do you want? What kind of tile do you want? So there's not an invested ownership. So the intervention of housing is falling short. And again, I'm going back to the elder. It's different when you ask us what we would like instead of telling us. And I think that for me, that's the story.
I think very quickly for me is being accountable of our privilege and finding one specific way in which I can alter that. When I get in my car and I ignite the car, I remember that the cables that are in that panel were assembled in Mexico, where the daily wage of a worker that is working 10 hours is $7 per day with minimal benefits. And those are American companies. And I'm benefiting from that. So what's the change of that is an immigrant that is trying to escape those realities of oppression and is doing their best to give us food on the table. And within that overwhelming reality of privilege, there's one piece that I can do. So I would say that owning, seeing the reality, seeing the system, owning accountability, and choosing one specific way in which I can alter that is the best way to begin.
Okay, I think Ruben is going to have the last word on that. Allison, if you want to close this out. And you're on mute, Allison.
Sorry. Thank you so much to our panelists, Ruben Parr Cardona, Jen Tomasini, Billy Joe Kipp, Anna Bauman, Melody Goodman. Thank you so much, Christine Andrews, for your incredible jumping in there and facilitating us like you always do. So great. Thank you, Sarah, for helping bring this event to everyone again. And the only couple things I want to say besides that thank you were that the recording will be made available. We always make the recordings available. So this will be up on the event website as soon as possible. The other thing we try and do, we did it for November, we're in the midst of doing it for the December event, is any Q&As not answered, we try and answer and then post them. So we did just release the November Q&A. We'll try to do it for the December event really soon. So this will be in the queue, but we will definitely do that. And the only other two things, you'll receive an evaluation survey. It'd be so great if you completed it. If anything, I know you guys loved this. I see it in the chat and I'd love to be able to share it with the presenters because we're so grateful to them for coming. So, and any other kind of learning you had or advice you want to have for future sessions, be fantastic. And just to note, our next session topic, we don't know the date yet, but will be around the role of psychological safety and implementation. And we're really excited to bring that to you and have some folks in mind already. And we'll get some details out soon. And again, please be on the lookout for the supplement of the Stanford Social Innovation Review that will be coming out in May. I failed to mention that that is sponsored by the Annie E. Casey Foundation, and we're deeply grateful for their support for that. We're 1 minute over. Sarah, do you want to just say a thank you and goodbye?
Just deep, deep gratitude to our panelists and to all of you joining us in this online space today. Lots to think about. Thank you.
Thank you.